All right, a quick note for all of our students here today. Pizza is going to be served on the way out. That was what we needed to do for logistics, and the pie was really busy today. So we'll make sure you get your pizza just at the end of the hour.
Test, test, test.
Test, test, test.
Too early.
Okay, one more time.
2:30.
I hear ya. Right, and then let me. General Wilmoth, go ahead, go for it.
Our nurses are the best.
I think I can hear you.
Okay.
I just,
Nope, went the other way.
let me swap it to you.
Other way, pal. How's that? Is that any better?
Love it.
Okay, sounds good.
It's very directional.
Okay.
Okay. Well, then I think we're going to get started. Our student staff's going to introduce General Wilmoth, and then off to you.
Okay.
Welcome to today's Hinckley Forum. My name is Rory Stewart. The Hinckley Institute of Politics is a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley Forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. Today's forum is titled Careers That Impact and Improve Global Health, and is presented as the American College of National Security Leaders Spring Seminar here at the University of Utah. In an era of geopolitical tensions, cyber threats, and evolving national security landscapes, America needs professionals who can lead with integrity and make ethical decisions in complex environments. This panel will discuss what led to their careers in the field of global health and explain the different career options available to students today. Panelists will also give their vignettes from their professional experiences in the field of global health. We are in for a great conversation. It's my honor to welcome our panelists. Let me start by introducing our moderator. Margaret C. Peggy Wilmoth is a nursing professional, academic, and retired senior officer of the United States Army Reserve. She is a professor at the University of North Carolina School of Nursing. She was promoted to Brigadier General in 2005, becoming the first nurse and first woman to command a medical brigade as a general officer and later attained the rank of Major General. Wilmoth received both her Bachelor of Science in Nursing and Master's of Science in Nursing degrees from University of Maryland, her Doctor of Philosophy from the University of Pennsylvania, and her master's degree in strategic studies from the United States Army War College. Wilmoth was a professor of nursing at UNC Charlotte, as well as the assistant for mobilization and reserve affairs for the Office of Assistant Secretary of Defense for Health Affairs. Major General Wilmoth will serve as today's moderator and introduce the rest of our panels.
Thank you very much. And I'm excited to see all of you here today and excited to see the students because this is about you as you begin to think about your 1, 3, and 5-year plans for your career. And so we're going to talk about careers in global health and how one may achieve a career in global health. As we heard earlier in the first panel today, that global health has 2 branches, clinical and public health. So how many of you here are in a clinical kind of a educational program? Nursing, medicine, dentistry? 1. Good, glad to have you. And how many of you are in a public health, epidemiology, MPH? Super, so we have some of those kinds of folks, and then others of you are much like some of our panelists today who have ended up doing a lot of global health work, even though that was not what they were prepared for professionally. So on our panel today, we are lucky to have our retired Lieutenant General Ron Blank, and I'll introduce him more in a minute. Dr. Ashley Bryant, who's a colleague of mine at UNC Chapel Hill, who's a nurse. And then Lieutenant General Castelaw, here to my right, who is a Marine Corps aviator, all of whom ended up having careers and making an impact in global health. So firstly, I would like to introduce General Blank. He was the 39th Surgeon General of the United States Army. He's a board-certified internal medicine physician. He's a former president of the University of North Texas Science Center, former chair of the Board of Regents of the America's Medical University, the University of Sciences University in DC. He started his career as a medical officer and a battalion surgeon in Vietnam. He is currently partner and chairman of the board of Martin Blank and Associates. He does healthcare consulting. He consults on bioterrorism and in working with the medical community in response to mass casualty events and other kinds of wicked problems. So I'm going to ask General Blank to first talk about his career and his pathway and how it has impacted global health. Sir?
Well, thank you very much for that very kind introduction, and pleasure to be with all my fellow panelists and with the audience, many students and others who are interested in this. You know, it's fascinating because most of us did not get into whatever our professional career was to focus on global health. And yet, I think you mentioned, that's what we ended up doing. So if you ask many people about healthcare, they're going to say something about, well, yeah, I see my doctor, I take medicine for diabetes, maybe I have my appendix out. What they're talking about is disease care, not health care. A few will add preventive medicine to that, and that's a very important part. But global health is more than that. It really is trying to optimize and provide a quality of life as best we can for every patient. It's actually a field of study, research, and practice, and achieving equity in health. It considers social, economic, cultural, environmental factors in providing health, in addition to all the rest of it that we've talked about. And as I think all of us have progressed in our careers, we first of all specialize in a certain area. As far as physicians, and I think most nurses, we like sick people. That's why we got into this. But in fact, we really need to, and have, as we've taken on leadership positions, focused on, providing that care for sick people, but obviously trying to optimize that health. That is what global health is all about. So I look at it as there's 4 goals in my career as I've gone through all the steps of in Vietnam as a battalion surgeon, where, by the way, I did mostly preventive medicine more than trauma care, because the trauma folks were seen in the hospital. Helicopter comes, swoop them away, and maybe I did some initial first aid, that kind of thing. But I was responsible for the health of my battalion. And so I made sure they took their malaria pills. I made sure they had their immunizations. I made sure that they were in as safe a position as they could be in a combat or field operation. So anyway, first goal is to optimize health and to maintain health and a quality of life. Second goal is try to prevent disease as much as you can. Third goal is to provide disease care, acute minor illness care, and for the military, it means getting the soldier, Marine, sailor, airman back to duty. And then the fourth goal is, if you need serious care for cancer, major trauma, and so forth, is to provide that care. So you're seeing now in all of those areas what kind of skills there might be required. Because when you talk about optimizing health, you're talking about education and health literacy. You're talking about workplace safety, talking about air quality, transportation. How do people get to health care? How do they get the information to adjust their behaviors? What about violence and nutrition? There are people that don't have enough to eat. There are people that are homeless, dealing with that kind of thing. Internet connectivity, isn't that an interesting one? And then, of course, substance abuse, alcohol, illegal drugs, and so forth, we want to take on. So all of this suggests to me that the kinds of things, if people want to get involved in global health, certainly should focus on the healthcare disciplines and professions, nursing, dentistry, physicians, PAs, nurse practitioners, all the rest of it. Preventive medicine and public health being absolutely critical. And then it's the other disciplines that need to be brought in, the transportation engineers, the people working on air quality, workplace safety, and so forth. These all are the kinds of careers that affect health and are part of global health. And oh, by the way, those of us that are really involved in it from that healthcare background really try to involve folks from all those other disciplines in attempting to achieve that optimal health. So I will close with that and say my 32 years in the Army were extremely rewarding. I enjoyed every bit of it. And I told recently a VFW audience, I'm not sure what was getting worse, being shot at in Vietnam or testifying in front of a congressional committee. Some ways, maybe the latter, but I will leave it with that, and thank you very much.
Thank you, sir. We'll come back at the end with questions. And I'd also like to add to something General Blank said, and a profession you don't normally think of as being important in global health are veterinarians. Because we heard earlier this morning, in Africa and in other places, they go out and they engage and they look at the animals looking for disease in goats and other animals, indigenous animals. They inoculate goats, for example, to prevent disease in that particular herd, and that prevents disease to the humans. So the veterinarians have been a very, very powerful adjunct to global health in the military. They play a critical role. It's not just taking care of pets. So they do so, and they also inspect all the food for the military. That is the role of the Army Vet Service, is to do the food inspections. So again, along with food inspections, keeping food safety, water sanitation, and veterinary assessments of the indigenous animal population is really critical in the military and in terms of thinking about global health. So it's beyond medical and nursing care. So I'd just like to add that little tidbit to what General Blank shared about global health in the military. Next, I'd like to introduce Dr. Ashley Leek Bryant, a colleague of mine at UNC Chapel Hill. She's also a tenured full professor, and she is our Senior Associate Dean for Strategy and Global Affairs. And that's what makes Ashley such an important linkage to this conversation today. She's also co-director of our PAHO, Pan American Health Organization / World Health Organization Collaborating Center on Quality and Safety in Nursing and Midwifery. So we have a role in global health in the Pan American arena. She also has had experience in building oncology nursing capacity in Malawi. And she's also been engaged in short and long-term immersion experiences in Honduras, Peru, Guatemala, Canada, and Russia. By background, she's an oncology and gerontology certified nurse and a certified global nurse consultant. She's also holds an interdisciplinary certificate in aging and a primary care certificate. And I'm glad to introduce my colleague, Dr. Ashley Leek Bryant. Ashley?
Great, thank you so much. And I appreciate the invitation to be here today. I have a few slides. I promise you I will not bore you, but the very first slide says I am proud to be a nurse, and I'm so proud that I am able to represent our profession. I'm just going to give you a kind of a snapshot of kind of my journey. And one thing I want to just share is that it looks very linear, but it's not. I think it's important just for you to see how I've been able to move from my bachelor's all the way to where I'm at today. So I had the opportunity to stay in North Carolina. I went to the University of North Carolina at Greensboro, completed my Bachelor's of Science in Nursing in 2003. Then went straight into a master's program, Master's of Science in Nursing and Nursing Administration, while I was also working full-time as a nurse at Wake Forest in Winston-Salem. Applied for the PhD program in 2006 and was accepted and started that program 2007, 2011 and completed my PhD, interdisciplinary certificate in aging, which really focuses on having different classes, seminars, learning opportunities with others across campus. Completed a postdoc, a 2-year postdoc in the School of Global Public Health with a focus on cancer care quality. And that was an opportunity for me to meet and network with others across School of Public Health, but more importantly, across the state of North Carolina. And then I've been able to rise in the ranks from assistant now to a professor at UNC. So that's more of, if you want to call it, my academic pedigree. Professionally, I've had so many different roles. I've worked all over for a number of years before I went to school. And so I've had several leadership and service opportunities, both in my undergraduate and graduate schooling. I've worked at all 3 comprehensive cancer centers in North Carolina. So that's Wake Forest, that's Duke, and that's UNC. And so being able to be a nurse and see how care is provided across those 3 was very amazing and also eye-opening. I completed a National Institutes of Health Clinical Center IRTA, and IRTA was Intramural Research Training Award. I did that in 2003 for 3 months, and that's really what sparked my interest in research even more. I'm a big believer in being certified, and so I'm an oncology certified nurse, as well as gerontological certified nurse. So that means I care for individuals with cancer, as well as individuals who are considered older adults or the aging adult. And then recently just received a certification as a global nurse consultant. And lifelong learning is continuous. And so I think just to give you a sense of who I am, that's me. Where did this global bug come from, right? I will say I am a native of North Carolina. My parents have never been on a plane. And it was my first time being on the plane, was on my way to Honduras in 2003. And so it was an experience that I had as a senior nursing student. And that really then enabled me then to have other opportunities. That was followed by, in 2005, I had a chance to go to Russia. Can you imagine that? And so that was another phenomenal experience. I was there for 2 weeks and looked at the healthcare system amongst the United States and Russia, and what could we learn from each other. Last but not least, 2009, during my PhD, I had a chance to go to Guatemala. And so that was with both undergraduate students and graduate students. So I've been able to experience this during my time both at UNCG and UNC. Then an opportunity came, and when that opportunity came, I thought, what do I do? Do I say yes? Do I say no? And I decided to walk through that door. And that opportunity was to be the Associate Dean for Global Initiatives at that time. And I'm showing you the strategic plan because it's important to know, when I stepped in the role, I thought, what am I doing? I was not sure this is where I wanted to be, but this opportunity came. And I thought, well, how can our strategic plan in the School of Nursing, which focused on responsible growth, collective well-being and relational health, and operational excellence, how does that align then with the Office of Global Initiatives? Then we had a retreat, brought different stakeholders together from our school. And when I think of global, this is what I think about. I think about ensuring that every student has a global education at UNC. What does that mean? That means not everyone's going to be able to travel outside of UNC. But I think about North Carolina, and North Carolina has many different opportunities where it is a local and global impact. And so there are no borders when it comes to global education. And this is where we have study abroad experiences for our students. We have students who just came back from Norway, from Australia, from Spain. We have a group going to Japan. So that's what global education means to me. Next is Fulbright specialists and scholars. We really push to ensure that we have faculty who can engage as a Fulbright scholar. We had one last year, Suja Davis. She went to Nepal, and then we have Fulbright specialists who are able to travel all over the world to learn and teach with other partners. And last but not least, planetary health, which really focuses on climate change, focuses on stability and sustainability. And then last but not least, our PAHO Center, which really focuses on the regions of America and quality and safety. As I mentioned, being at UNC, it's about the global guarantee, promising that every student has an opportunity to receive the education that they deserve. So as I come to a close, I just want to remind you, this is something I love, Dr. Maya Angelou. And as a nurse, I think about this often. People will forget what you said. People will forget what you did, but people will never forget how you made them feel. And that is relevant in the States as well as across the border. So I encourage you to think about, when opportunities come your way, please consider it. And just remember, it doesn't always have to be the way that it has been done. So thank you.
Thank you, Dr. Bryant. We'll come back with questions in a few minutes. And I want to footstop something that Dr. Bryant said, particularly for women. We tend to say, I don't have enough experience, I don't know enough, this isn't the right time. When somebody offers you an opportunity that's maybe a left turn from what you thought you wanted to do, you need to run and go through that door because the door will slam shut behind you. I had that opportunity as a battalion commander. I was commanding a hospital in my reserve world. I had an opportunity to leave that job early and be a chief of staff for a one-star general outside of the medical arena, way out of my comfort zone. Thank heavens the man was patient and called me 3 or 4 times. And I finally, kind of hit myself inside the head. And oh, Peggy, you need to do this. And I took the leap and I did something radically different in my career path as an Army Nurse Corps officer. And I got a chance to witness how the rest of the Army worked at a time when 9/11 happened. And that was an invaluable learning experience for me. And because of that, I got the attention of those who sat on the general officer decision board. And long story short, after a couple other left turns, right turns, I became promoted I got lucky enough to get promoted to general officer. But the point being, had I not stepped through that first door that someone knocked open for me, that door would have been slammed and I wouldn't be sitting here today. So when someone offers you an opportunity that you don't think is right for you, don't second guess yourself, run through the door and take that opportunity because you don't know where it will lead you. Had I listened to my father, who said, don't join the Army, your wife and a mother stay at home, I would have stayed in my little nursing box and I wouldn't be here today. I did not listen. So it's really important to listen to your heart, listen to your gut, and when someone offers you an opportunity, take it and run with it. And I really like that slide you had, Ashley, about the opportunity and the door opening, because that is so true, and so many of us have had opportunities that we would not have imagined having had we stayed in our planned pathway. So that's why I'm saying a 1-year, 3-year, 5-year plan, but not beyond that, because you don't know what's going to come your way. And now I'm going to turn to our last speaker, who's kind of an example of that in some ways, Lieutenant General Castelaw. His career path was as a Marine Corps aviator. His final assignment was as a Deputy Commandant for Marine Aviation and Deputy Commandant for Programs and Resources for the United States Marine Corps. He held a variety of key assignments ranging from Sarajevo, planned and led humanitarian operations in Asia, Africa, and Europe, served as Chief of Staff to U.S. Central Command during Operation Iraqi Freedom. He is also co-founder and CEO of Farm Space Systems, a provider of remote data collection, management, and equipment. And he is currently leading an interdisciplinary team developing rapid screening capability for pathogens in humans and animals using advanced sensor technology integrated with artificial intelligence. And fun fact, he appeared in a National Geographic series on climate security. So a Marine aviator here talking to you about global health career pathways. General?
Well, thank you. Thank you very much, General. The guy that was the central theme for that National Geographic special was Schwarzenegger. And we did the filming of it at the Army-Navy Club in D.C. And, Schwarzenegger is a tough guy and everything, so he comes up and we go in there. It's too hot in here. Turn the air conditioner on. When it gets cooler, I will be back. Took 45 minutes to get the room cool enough for Schwarzenegger to come back in. Any farmers or rancher background in here? I picked you out from the first that you were going to be with the shit kickers you got on, As we think about journeys, I graduated from the University of Tennessee with a degree in agriculture, a commission in the Marine Corps, and a brand new wife who's sitting back there. And I told her the first lie that I ever gave her, and that was, honey, we're going to be back on the farm in 3 years. And we spent 36 years in the Marine Corps. But she was the hero of this outfit because during those 36 years, she moved us 25 times, 25 times. And during that time, she was the one that was the medical professional. She was a screener at a mental health institution in Yuma, Arizona. Anybody ever been to Yuma? You know, they don't have the A team down in Yuma, okay? And she's been working for ICON. Anybody know what ICON is? A vaccine testing and so forth. So she was the medical person. I didn't really run into to what I thought was significant medical challenges until I went to Europe, to the U.S. European Command. I was a lieutenant colonel, so I was at the bottom of the rung in the staff over there. But there was something happening, sort of like it's happening today in terms of world situation, and that was the Soviet Union disintegrated. And the wall came down, and UCOM had been focusing on fighting the Soviets, getting them in the Fulda Gap, and fighting them on the seas, keeping the lanes open, and so forth. That was what the focus. And all overnight, the focus, after about a year or so, became keeping them from disintegrating, becoming unstable, causing migration, making a condition where we might have to do a conflict. Commit the most precious asset we have as a nation, which is the blood of those who serve. And what we did was we started sending medical supplies and food to the former Soviet republics. I was on a little group that coordinated all that, and I talked to people, aircraft landing in Irkutsk or Kiev or something like that would have a load of medicine on. I went up to Ramstein and helped put together 7 field hospitals to put on trains to send to the former Soviet Union. And what we were trying to do was employ an element of national power, which was humanitarian and not shooting. And I like to think that our intervention at that particular time with those assets prevented a situation that we're unfortunately starting to deal with now. That if maybe we had done a little bit more working with them along those lines, it would have made a difference. Okay, and then started doing stuff like going to Lake Chad. And as I go through here, there's 3 themes that you'll sort of understand. One of them is climate change, okay? And then the Sahel in Africa, drought. And in the Lake Chad Basin, you were having the herdsmen up north, who were mostly Muslim, come south. The fishermen were driven off the Lake Chad because it was drying up, and all of them were trouncing on the corn crop of the Christians down south and creating instability and migration and so forth that we tried to get involved with to try to ameliorate the situation so it would not come to a point where we would in the future have to fight. The other part's human. You've heard about the humans, the danger that my friend General Gratian talked about with the avian flu and the danger to humans. And Peggy here stole my story about veterinarians in the Horn of Africa. Okay, so those 3 elements, climate, animals, and humans, all interact into what we call One Health. Okay, Clemenceau, who was Prime Minister of France during World War I, famously said, "War is too important to leave to the generals." I say global health is too important to leave to the medical professionals. It's going to take an integrated team of non-professionals, and we're already seeing it. My wife there and I are running a small company where we're trying to develop a capability to identify disease in your breath. One of the big elements in doing that is AI. Being able to take images with a sensor, put them in a library, refine them, get a bunch more, and run the AI process so that we can have a signature that we can depend on, and it's agnostic, looking for in humans or in animals or on a fence on that farm that you came from. You from Utah too? New Mexico. All right, great state. So when you think about medical support, it's not being just doctors or nurses or stuff like that. It's being technical engineers. It's being folks that do logistics, that do planning, and so forth. And why am I asking you this? We are at one of the turning points in history right now. One of the turning points in history. Each of us has got to do more. We're going to have to do more thinking about how we're going to deal with that Lake Chad Basin. And it's not going to be bombing them. It's going to be providing support, education, technical expertise on how they're going to deal with the hunger and the health challenges that are going there. There are going to be people that organize truck convoys that take supplies into some of these locations. And it's going to be many other everyday tasks that somebody is going to have to support in order to make the medical portion of it work. So, if you don't want to be a doctor, think about what else you can do to support global health, maybe getting into a medical equipment company that builds machines that will do what we're trying to do, or other such things. But it is so important now that we regain the sense that we should have in terms of being part of something bigger than we are, something that will make a difference for the future and for not only the United States, but globally. I look forward to your questions. Thank you.
Thank you very much, General. I appreciate that. Sorry to have stolen your thunder.
Yeah, it's happened before.
I know. So that ends our 3 presentations. Do you all have any questions? And otherwise, I have a few that I can ask our panelists. Does anybody have any questions that they'd like to start off with? Okay, I'm going to ask Dr. Bryant sent in a couple questions. I'm going to ask, so Dr. Bryant, what skills do you consider essential for a career in global health, and how do you develop those?
That is a great question.
You wrote it.
Yeah, that's right. That's right. I would definitely say emotional intelligence as one. Being fully aware of yourself, aware of your strengths, areas for growth, and allowing those around you, your team members, and sharing that with them. I definitely think that is a key message. 2, for me, it's integrity. I think that's key to being in global health. In any leadership role, you need to be able to stand up and no matter who's in the room or who's at the table, how you feel, are you decisive in your decisions, and are you able to move forward? And 3, I would say, you gotta have compassion. There's the empathy. You gotta have a sense of understanding people, understanding relationships. And so how do you achieve this? I think this is one way. So to those who are joining today, I think one way is learning, asking questions. 2, being a part of an apprenticeship or preceptorship, connecting with others to ask them what are some of those life lessons that they've learned and things that they could share and pass on to you. A lot of this too is, hands-on training. But I believe you really can learn a lot from others who mentor, coach, advise you. So I would encourage you to reach out to others and be open and do some role playing.
Thank you. Thank you. Any questions from the audience? If not, I've got one for Dr. Blank. This is a bit of a twist on the one that you sent me, sir. How would you define success in doing global health work?
In many, many ways. So global health is, as we've all talked about it, just a comprehensive way of looking at individuals and optimizing their health, taking care of them when they need it. So how do you define that? Well, first of all, there are the social aspects of it, less substance abuse, less homelessness, less hunger, all of those kinds of things. There is the measure of access to health care. How do you get it? Who does it? And then there's the other metrics that we all know in healthcare of the quality of care provided. But global health is so much more than that. And so it goes back to what I originally said, those social determinants. But by the way, I have to add a little anecdote I was thinking of as some of the other panelists were talking. I commanded the hospital in Berlin in 86 to 88. Wall was still up, Fulda Gap was still real, all of that kind of thing. And we had a patient there who I thought was an absolute example of optimizing health. Unfortunately, he was a prisoner at Spandau Prison. And I bet most of the audience don't know who Rudolf Hess was. Most of the panelists probably do, but that's just because, well, I'm older than everybody, but that's just because of our age. Rudolf Hess was Hitler's deputy and was imprisoned from July of 1941 until his death, 17 August of 1987. So he was in prison longer than I was alive. And in prison, he exercised, he had no issue of where his next meal was coming from. He had nutritious food. He didn't smoke. He didn't drink. But he was a prisoner. We don't want that. We have to convince people that they should, use the behaviors that we can measure. And one of the big successes, by the way, in the United States of a public health measure was the education on smoking. And so it went from, I forget what the percentage was at one point, 35 or 40% of adults to now less than 20%. And it's been a great success in the military too. Although soldiers being soldiers, they're using too much of the chewing snuff, the smokeless tobacco. So, drives you crazy. Anyway, those are some of the measures that you look at. There's societal measures, there's the public health measures, and then obviously the direct care measures.
Thank you, sir. You talk about using snuff. I tried telling a Marine one weekend, he had a big jaw full of it, and I said, well, one of these days, I used to be a head neck oncology nurse. One of these days, you're going to be a patient in my head neck unit with half your jawbone missing and half your tongue missing. And I don't know that I made an impression on him, but I'm hoping he might have thought twice about using that stuff because it can lead to cancer use, or cancer, head and neck cancer. So just an aside there. So I'm going to ask the audience. I've heard several times since I've been here, we didn't get enough snow this year. It has been a very dry winter. There's not much snow left on the mountains. What kind of health impacts do you think that lack of snow is going to cause this spring and summer and fall here in Utah? If you think of it in terms of global health or public health. Yes, ma'am.
One issue is when we have a lack of water, the Great Salt Lake is drying out, and so when we have wind and stuff, that blows toxic dust into the air, and so that hurts respiratory and kind of for all of you.
So for those of you online, the lack of snow going to dry up the Great Salt Lake, and then the air's quality is going to have toxic particles in it as the wind blows. So that is a global health or public health danger from the lack of snow. What else? Farmers in the room, what else was the lack of snow and water mean to your crops and your herds of animals?
You bet.
What do you grow in New Mexico?
Hay, okay, you grow hay. So what's the lack of water going to do to your hay crop?
Probably restrict the water going in, the amount that we can grow, much more structure.
And reduced production is going to mean higher costs later on. And we have a global health impact now with the issue with the Strait of Hormuz being constricted, and fertilizer can't get over here as easily. So worldwide, there's going to be a lack of fertilizer for crops, and that's going to reduce production globally, which means more and more people are going to get hungry, which means leads to more disease, more health effects from that. What else more locally here with the lack of snow? Yes, sir.
Sometimes a dry and arid climate can be bad for people's skin or just be bad for people's health in general. And along with toxins being in the air, it's very common that allergens will also be in the air too. So a lack of snow kind of like closes off that filtering process in a sense of taking the allergens out of the air and also kind of resetting the climate, especially in Utah where it's super dry.
So it's already a dry climate, so then lack of moisture, allergies, skin diseases. No one's mentioned fires. Is that a risk here? And lack of water to put out fires, and you get fires, and then you get more toxins in the air. So, and
there's fire in the valley, then everyone's breathing it in.
right, and then it'll settle down in the valley, and then it becomes a more global health effect. So just thinking locally here, without a lack of, with the lack of snow, you're seeing health effects here in the area. Combine that with pollution from automobiles, even though some of us have hybrid or all-electric vehicles, which still require energy to run on. So you're not getting rid of the energy requirement for that. And more people will be running air conditioners because it's going to be hot, and then that's going to also have side effects of toxins in the air and energy demands. So if you could think about in a developed country, in a developed city, in a developed state in the United States, what the health effects are for climate change just locally, think about it more globally about what's happening. Yes, General Cook.
General, the big issue I can bring it up is our air pollution here. I mean, I think it's, I used to live here, now I come back and I almost can't breathe. That's a huge health issue. I think we have to clean it up, be able to get the Olympics. So that is, it faces every one of us that live here.
Mm-hmm. Air pollution. I know before China got the Olympics, they got rid of all of their coal fireplaces and coal stoves, because that's how Beijing was able to get the Olympics there. I think they may have reverted back by now, having been there after the Olympics. But anyway, global health, and also is going to affect transportation. And as the general was saying, part of public health or part of global health is being able to get to healthcare or have healthcare get to you, and having adequate food supplies and having adequate communication. So, General, I'm going to turn the last question back to you, and I'm hoping somebody in the audience will ask a question by then. So you've talked about global health as being an interconnected system of human, animal, and environmental factors, increasingly shaped by artificial intelligence. From your experience, what role do practicing human medical professionals play in global health? You wrote it.
Wanted in. You know, I've had the opportunity since we've started doing this to get to interact on a daily basis with medical professionals. One of our team members is the former head of the University of Tennessee Health Science Center, actually the dean of the medical school. And his insights into what is important at the deck level. You know, I look at it from 10,000 feet, he looks at it from the deck level at individual patients, which when collected gives the population. So that's been a very important factor for us, was to have that expertise at the deck level that then can be correlated to the 10,000 foot level, and then you can make policy and planning that takes into consideration what the challenges are there. And that's been the biggest influence from a medical professional that I've had.
Thank you for that. One of the things I hope the audience is taking a look at, that none of us went in a straight line to what we're doing today and what we were able, where we've gone in our careers. If you look at the general, he started flying Marine helicopters, rotor wing, and now is a global health expert working on using AI to try to create ways to detect disease early, so before it becomes a pandemic, because we are at risk for another global pandemic. Do not be surprised that that is a reality out there. So he's taken his skills and expertise and his knowledge of what he's seen to do something looking forward to try to prevent a global health catastrophe. So you don't have to have a straight line from A to B to C to do something unique in your lives. My thoughts are that you are open to new possibilities. You might be studying something in particular now in college, whether it's political science or journalism or international relations, but you don't have to be locked into that. You have to be open to other possibilities and opportunities as things come your way, and be willing to risk, to do something unique and different, to step out into places where you might not be comfortable. But if someone sees something in you and says, I'd like you to try, don't doubt yourself, because they may be seeing something that you completely have a blind spot on. But they've identified something in you that is new and unique, that you're going to blossom in a new way, that in a way you may never, ever have thought about ever in your life. So risk, be willing to step out of your comfort zone. Don't let other people box you in and tell you what you can or should do. I was having a discussion with another leader here in nursing last night here on campus, and we both came from families who told us to stay in a box, and neither one of us did. And I don't think either one of us look back and regret that we did not stay in the box someone painted for us to be in. So think beyond and be willing to think bigger than what you thought you might be willing to do, or what your family might be comfortable for you to do in your life. You need to live your life the way you feel it and see it, and not be hemmed in by others' expectations. So, pending other comments, questions, General Blank? Yes, sir.
Yeah, I would like to emphasize to the audience, whatever you choose, let's say it's as somebody in public health or in nursing or in transportation, be very good at what you do, and have that as a basis for then reaching out. And I'll restate what has been already said multiple times. Uncle Fred said, I speak to a lot of people coming into the military. Uncle Fred always said, don't volunteer. Well, that's good advice if you're on patrol and you're volunteering for point. Don't do that. But for everything else, take every opportunity to volunteer, to expand and broaden your outlook, your experiences. You'll learn about things you never knew about, and they'll start thinking about you as one who is the go-to person. And that's a very, very good thing. So get the basics down, be good at what you do, get your certifications, all that kind of thing, and then do the rest. And Peggy, you said it very well, and it's so important. I just wanted to repeat it. Thank you.
Thank you, sir. I think our Hinckley interns here could probably echo the same thing. Students, if you get a chance to talk to Mark and Kaya and Justin, wherever he is, that the opportunities they've had through the Hinckley Institute as our interns have really opened doors to them and opportunities to them that might not have been here, available to them previously. So I would also ask you to talk to the students who've been interns with us at the American College of National Security Leaders, because they've had opportunities to engage not just with ambassadors and admirals and generals and other scientists, but other people and players in DC when they've spent time there. So have a chance, students, if you get a chance to talk to them, because they will also say that they stepped into the unknown when they decided to intern with ACNSL. Dr. Bryant, did you want to have any closing comments?
I would say just, I would encourage you to be curious. Just be curious and assume good intent, that sometimes we make assumptions about individuals or communities, but we sometimes don't know the full picture. We're only seeing what they're bringing to us. And so you're needed, and we need you with all the different skill sets that you're bringing now to us and into our world. And I agree, when opportunities come your way, really think about walking through that door. And I love what you said, Peggy. People will try to box you in of what they think you should be doing. And this is the time frame, you get married, you have kids, all of these things. There are so many opportunities out here. So thank you. But be curious, stay curious.
Thank you for that. General, you get the final word.
Word.
I will say the two four-letter words I told my children that they could say was work hard. None of us got to anywhere we have gotten to without hard work. And so, and Dr. Blank said it best, be good at what you do. That means you have to work hard at what you're doing. You need to be good at what you do. It means hard work, it means sacrifice, but that's how opportunities open their door to you. So work hard and prosper. Live long and prosper, is that what it is? So,
That's it.
okay, thank you all very much for being here. Look forward to talking. You have one question? Yes, no?
Sorry, I was clapping.
Oh, well, I'll clap back. Thank you so much.
Yeah, thank you all for being here. There's pizza outside. Feel free to stick around and chat with our panelists. And yeah, have a great rest of your day.